Welcome back to Forum 40. With us now is Atlantic County Public Health Officer Patricia Diamond. You've been busy lately with Ebola and enterovirus and, of course, flu season. So what is your role in the community? What do you do to try to educate the public? And what do we need to know about these illnesses?
Well, public health's role in general, Robin, is to keep people well, to keep the population healthy. So we really want to prevent you from getting ill. And one of the things that we really do and have done for many, many years is we serve as a communication resource between the State Department of Health and our local healthcare providers, our hospitals, and our schools. So any information or updates on things such as enterovirus, D68, or Ebola, or influenza, we make sure that that gets out to our partners in a timely fashion.
And they, in turn, get it out to the schools or the hospitals, the patients, whatever's needed.
And they also implement those measures as guided by the State Department of Health, who quite frequently gets their information from the Centers of Disease Control. So it's a transfer of information, good communication, and it's updated routinely. So we are constantly in touch with our healthcare providers so that they can get as up-to-date information as possible.
I know you asked me if I got something that came home in my kid's backpack, and I did, about Ebola and enterovirus and 68.
And that's one of the ways that we actually work with our school systems. We reach out to our school superintendents and we advise them, say, of enterovirus D68, it's appearing in New Jersey, and these are some of the measures that you can put in place so your parents can be educated as far as how to protect your child from getting ill, because again, our business is trying to prevent illness.
So you educate the community and you offer educational resources. How do you do that?
Well, we provide community education or group education. We're actually now promoting a program called Infectious Disease Prevention, where we go over general infectious disease prevention methods and also provide information on enterovirus, D68, and Ebola.
And who gets that information? How do you get that to the public?
We actually contacted our mayors and our superintendents of schools and our school nurses, our daycares, so we're getting that information out to that community in that fashion. And we have received a number of calls requesting an educational program.
That's fantastic. I think that's great to do. What can we do as a community? I mean, we hear about it all the time, wash our hands and so forth, but what do we really need to know, and what do we do if we suspect any of these illnesses?
Well, what you really need to do is just to try to keep yourself and your families healthy. Make sure you get enough rest, make sure you're eating properly. If you haven't obtained a flu shot for yourself or your children, to do that. We have still a general public health clinic that we have set up in Ventnor on November 6th from 10 to 12 at the Lafayette School. After that, we'll be having public clinics at our Stillwater building in Northfield from 9 to 12, and that's just a walk-in. No appointment is necessary.
What do you do in these clinics?
Well, we provide influenza shots, and also those individuals 65 years of age or older who have not had a pneumonia shot, we provide them as well.
Is this for people with or without insurance?
This is for anyone.
Anyone?
Anyone can then come to our clinic. Those individuals that have a Medicare B card, there's no out-of-pocket costs. Everyone else, there is a charge at cost of $15. But we encourage everyone to get a flu shot if they haven't so far this year.
How do you find, when you hear about these illnesses like Ebola or enterovirus D68, just do you get more calls in your office? Are people more concerned, or do you hear it more, or does it not really affect you?
We do get many, many calls, not only from the public, but also from the State Department of Health and our hospitals, our urgent cares, just to, if they've got a question from a parent or they've got a question concerning a patient, and we try to get them the information that they need to make an appropriate decision. So often we walk them through the steps, but sometimes we actually walk them through in communication with the State Department of Health. So our big thing is communication, to make sure the information is accurate and as up-to-date as possible, so we can give the best information that's available.
You're Atlantic County, but all of our counties have a department like this.
All the counties have a department. Actually, every municipality has one. How they choose to provide their public health services is up to the municipalities. Many contract with the county to do it. Some have individual health departments. Say Atlantic City, they have their own health department. Cape May County, they cover the entire county. Camden County covers the entire county. So it depends on the municipality how they choose to provide these public health services.
And if someone watching say wanted to get more information, you have a website that has a lot of this information.
We
correct?
do. It's www.aclink.org/public health, and we are constantly updating information that we receive from the Centers of Disease Control and the State Department of Health.
How often does this information change?
Oh, right now with this season, it's pretty much Centers of Disease Control is updating their information continuously depending on the providers, healthcare providers, schools, emergency rooms. So as that is coming down, we've been updating it pretty regularly.
People are concerned about these many diseases, but we talked about the flu that's been around forever.
Right.
Do you find more and more people are getting the message about getting a flu shot, or do we still need to really drive that home?
Well, what we're fortunate with is that everyone is sending the same message. Our hospitals are sending the same message. Our public health providers are sending the same message. Our daycares is to get a flu shot. The best way to protect yourself against the flu is the flu shot.
Do you hear any concerns from people about reasons that they don't get flu shots?
We do. We have some of the myths. Unfortunately, we still hear. Like, I'm not going to get it this year because I got it last year because I got the flu. I never got a flu shot before. I got the flu shot last year and I came down with the flu. Well, there could be several reasons for that. It may not be the flu, number one. They could have been incubating the flu before they got the flu shot, because it does take 2 weeks from the time you get the flu shot to develop an immune response.
Absolutely.
So
and also, Dr. Gervetti mentioned it's not 100% protection.
No, it's not 100%.
So there could be a different strain that you get, but
Right.
you're still giving yourself a better chance of not getting it.
Yes, and you want to, again, avoid getting the flu, because especially for those people that are, say, over 65 or pregnant, have an underlying condition that may make them more difficult to recover from influenza.
Right.
There's many hospitalizations associated with influenza and also deaths, so people really need to take that illness
And how many deaths
seriously.
is it?
It's usually between about 24,000 and 36,000 a year. Now, it may not be.
I bet a lot of people are surprised to hear that from
Yes.
the flu, or problems related to the flu.
Right. It's usually complications from the flu, like, say, if you have a heart disease, suffer from asthma, or some other condition that compromises your ability to get over an illness.
Pneumonia.
It can turn into pneumonia, sinusitis, severe ear infection, bronchitis. So that's what you're really trying to prevent.
So thousands and thousands of people, we have hysteria over Ebola, which 3 people in this country have contracted,
Yes.
and yet the flu is sort of like, it's the flu.
It's the flu, right, exactly.
We really need to drive that message home, that and there's no excuse. I mean, there's free clinics if you cannot afford it.
Yes.
And you have them, and you have that information, I'm sure, on your site, and Cape May County and other counties in our state.
And many of our pharmacies are also offering the flu shots.
That's
so
true.
It's very accessible. There's no shortage of flu vaccines, so it's there and it's available. But in addition with the flu shot, we also do recommend those basic hygienic measures: to wash your hands frequently throughout the day, to cover your coughs or sneezes.
And cough this way,
right.
not in your hand,
Right.
because then you touch things, right?
Yes.
So I always tell my kids, use your elbow.
And that became popular during H1N1 when it was affecting the younger children, and it was called the gorilla cough or sneeze, that you could just kind of just sneeze right into your sleep, and that was okay. You can catch that. You can catch that cough or sneeze.
That's okay. Right?
Yes,
but
that was okay.
To get that message out, and also wash your face as well. That's another thing I've been told. Not just your hands, but germs can enter through your mouth or your nose.
They can. We don't realize how many times that we actually touch our face, where you can actually transfer.
Oh yeah, people sit and then all those germs gets transferred. But in school especially, because the kids, can spread it.
And what we really do emphasize is washing your hands. Hand sanitizer, is not a substitute for hand washing, especially with this enterovirus D68. It's not to be, hand sanitizing is not effective.
Right.
It's actually hand
And
washing.
don't just run them under the water. I heard sing happy birthday twice.
Happy birthday twice. It's 20 seconds.
Right, and then make sure your hands are really clean.
Yes.
So, all right, we'll have to make sure all of our kids do that, and all of the adults as well.
And be a good role model.
Yes, absolutely. Do it yourself.
Do it yourself.
That's what I've always said. Better to follow what I do rather than what I say. Absolutely. Well, great. Thank you so much, Patricia Diamond.
Okay.
Really good information. We appreciate your joining us today. And up next, Galloway School Superintendent Dr. Annette Giaquinto and Chief Safety Officer for Atlantic Care, Deborah Fox. They'll discuss how we're protecting people in our schools and our medical centers. Stay with us.